6 months ago I started working at Jackson, and I came back from work, and my mom and dad had been visiting, and they just said they noticed the dog wasn't really moving as much. She was just in her bed. And I mean, I didn't really think anything of it. I just gave her some medicine, pain medication. And then the next day when I got back from work, she wasn't moving at all. She seemed very uncomfortable to get out of her bed. And I immediately took her to the ER, I forget the name of it, the referral center that sent me. And the doctor looked at her and said that she was weight bearing on her back right leg, but her left leg she was not using. And that's normally a sign of like some sort of spinal issue. That if I didn't take her to you in like 24 to 48 hours, there was a chance where she would be paralyzed. And I mean, she's been blind since 1 year old, so it's not like she moves a lot, but I think just for quality of life, it would be poor if she had, you know, no eyesight and struggled to move. So that's why we took her to you. It's extremely scary for me, like driving here. Everything I did like seemed to hurt her. So it was actually a little bit of a relief when I got here to like have you look at her and say it's like it's uncomfortable for her, we'll take care of her. I think that was more of a relief for me than anything. I know you called me right after surgery, like I think an hour after you went in, and that was just a relief to know that first she was in good hands and that she was awake and she'd come through the surgery. And then every day, you know, one of your staff members updated me. And I was super happy about that, just knowing that she was here, she was comfortable, taken care of, and not in any pain. But her surgery went very well. And I mean, it's 2 weeks and she's walking, well, I can say much, much, much better. She actually wants to run.
We saw Bella on an emergent basis after hours, and basically on examination she was unable to walk without support, but she had really strong movement in the left pelvic or left rear limb, where there was almost minimal to none in the right pelvic limb. She still could feel the right rear limb, so that told us that she had a spinal cord problem affecting the mid-back or thoracolumbar spinal cord, more off to the right side. High on our worry list was something called a fibrocartilaginous embolism. And the hallmark of a fibrocartilaginous embolism, we classically see it in bigger dogs or large breed dogs when they're being active. It usually comes on suddenly, so an acute onset. It's usually very asymmetric, so affecting one side of the body more than the other. It's usually non-painful, which was the case with Bella, and it usually doesn't get worse over time. This was something that was happening rapidly, so we really didn't have a lot of time to say whether it was getting better, worse, or staying the same, because it had just happened that morning. So we recommended an MRI, and an MRI was performed of Bella's thoracolumbar or mid-back spinal cord. And what we saw in the MRI was a wedge-shaped or triangular, what we call hyperintensity or bright spot within the spinal cord, right at the junction of her thoracic region and her lumbar region, we call T13L1. This is the classic imaging appearance of a fibrocartilaginous embolism, so that's what we diagnosed Bella with. Treatment involves time and physical therapy, so she's checking in to be with our physical therapy department. The likelihood of her regaining the ability to walk is in the realm of 90%. I suspect that she's going to make a very, very good recovery. It will probably take time.